So before we talk about specific types of surgery and the specific risks to that surgery, it's important to understand that any surgery has risks. There's always a possible risk of things like bleeding, although that's quite rare around the eyes, infection, and then also there's always risks of scarring and anesthesia. Fat grafting or fat transfer surgery is where we take some fat from elsewhere in your body, typically the inner thighs, sometimes around the belly or the flanks, and we use that fat like a filler to restore some of the volume that you've lost in your face. Fat grafting is a great option to augment many procedures around the eyes, but it's important to know that there are some risks. Number one, the fat partially will get resorbed. It's really hard to predict exactly how much. Usually it's around about 40%. That's what I tell people. And it depends on what kind of fat is put in and just how your fat behaves. Some of the fat is going to go away, and that's important to know. The other end of that spectrum is that sometimes the fat is too much or can clump together to where you have these deposits or lumps or nodules under your eyes or around your eyes, and that can be something that is a risk of fat grafting surgery. The other risk of fat grafting surgery that's important to mention is the risk of infection. All my fat grafting patients get antibiotics as a prophylactic therapy after surgery, but it is a risk with the surgery. Lastly, with fat grafting surgery, as the fat can sometimes get resorbed, it's possible that we have to do it again to restore some of that volume. People will have some pain or discomfort, honestly more around the areas that we take the fat from, as opposed to in the face where we put the fat. So it's important to know there is some discomfort after that surgery.